Welcome to Open House with Gerry Cornejo, where we feature people, places, and things that are in the news or who should be in the news. And our topic for this program is about health. It's about dental health. And the topic is going to be biological dentistry, something that I think not too many people are familiar with, but should be. And we have one of the few practitioners of biological dentistry in the Philippines and probably in the world with us now. And it's none other than our very own Dr. Nelson Gaba. Doctor,
Yes.
welcome. Dr.
you,
Nelson Gaba, what is the difference between, I guess you'd call it that traditional or conventional practice of dental medicine to biological dentistry?
Well, I would say about 3 items now. If I may define biological dentistry, it's that field of dental science that looks and considers the effects of dental materials, techniques, and in its effects to the whole body. It also unites basically the. Can we cut it for a while?
No, go ahead.
Okay.
Yeah.
Very good. It also unites the medical profession. Oh, or should I say?
Let me ask you one thing, though. Let's backtrack a bit.
Okay.
Am I right when I say you're one of the few practitioners of biological dentistry? Because I always knew there were dentists who would believe in that or practice biological dentistry, but then I have not come across anyone until you were recommended by our good mutual friend, si Dada Shivisananda.
Okay.
So, are you one of the few in the Philippines? Are you the only one, or okay?
I'm board certified by the International Academy of Biological Dentistry and Medicine. I believe there are only 2, but of course I would like to believe that there are many more who wants to practice biological dentistry.
But in the Philippines, there are only 2 members of
That's
that
right.
organization.
Well, based in the States, yes, who are board certified, but there are other attendees, Philippine dentists who attend said institution.
Okay, walk us through this, Dr. Gaba. Somebody has what we were talking about earlier was the case where traditional dentists or conventional dentist practice would recommend that root canal. We were talking about this a little bit, no? So when it comes to conventional or traditional practice of dental medicine, who are the patients or what kind of tooth would require a root canal? Not your practice, the traditional, conventional. So they go to a dentist, they sit in the chair, open mouth. Oh, what kind of tooth would the doctor see that he would recommend you need a root canal?
When the tooth is badly decayed,
Okay.
a decay that wouldn't, pass to an ordinary filling or restoration, that's quite deep, that is almost connected to the nerve now.
Okay.
When in terms of infection or contamination with bacteria,
Okay.
they would recommend a root canal. I have to make mention that the tooth is an organ by itself.
Okay.
It has
Every tooth.
Every
tooth is an organ by itself.
Yes,
Okay.
just like your kidney, your liver.
Okay.
It has its own circulatory system, blood supply, lymphatics now.
Okay.
Now, once you do a root canal, you create an opening on top of the tooth, insert needle-like instruments, and try your best to cut the nerve.
Try your best.
Yes, to cut the nerve, and
Oh.
to basically remove everything that's there in the nerve, and try your best to sterilize and seal the nerve.
Okay.
And seal the canal. The canal is basically what houses the nerve.
Okay.
And try to make what we call a hermetic seal.
Okay.
Okay. And then in my opinion, you're actually just alleviating the symptom of this pain because you just remove the sensory organ. But then what happens is basically when those blood vessels, those red blood cells and white blood cells that doesn't go in there, if there's no nerve supply or no blood supply bacteria settles in. Okay.
In
And-
the same area where the root canal was performed.
Well, yes.
Okay.
You see, a dentist would basically seal the canal, but there are accessory canals and even the dentinal tubules to consider.
Okay.
Because these are basically openings or tubules, as the name implies. Fluids goes in and out, in and
Okay.
out.
So, doctor, the traditional, conventional practice of dental medicine, you'll see a tooth so, devastated, and kailangan na, and I'm sure the majority of our audience who have been to dentists or know of a relative or a friend or they themselves, they have undergone a root canal and they know a situation wherein the doctor will say, root canal na yan. Okay, now, the same person goes to you. You practice biological dentistry. What and how are you going to treat this person? Whereas your counterpart would say, root canal, we do this, we drill, what the process you described. Now, what would you do, Dr. Gaba?
A lot of times I would still try to save the tooth, but by not doing root canal. I try to check the areas concerned, now, if they're really that bad or really deep-seated.
Okay.
If a restoration or a filling can still be indicated, I usually do a filling.
Okay.
But then if in case I draw a line when to save and when not to,
Okay.
in my opinion, root canal is not an option for me. I would rather remove the entire tooth
Yes.
than to establish a bigger problem, which will be not just an acute infection, that will be something that will be chronic eventually. So I would rather remove the source of the problem.
Okay, so what happens? So, magkakaroon na lang ng denture, nagkakaroon na lang ng pustiso ron, ganun ba?
Okay, so when you remove the tooth,
Okay.
you just don't remove the tooth. You have to clean the socket also.
Okay.
Then allow it to heal,
Okay.
after which you give the patients options.
Okay.
Basically, options like you would like something that's removable, fixed, or something like an implant, or
Okay.
something like that. Of course, these are options that the patient needs to know
Okay.
and to be informed so that they would, they're entitled for these options.
Okay.
And then, of course, you explain the pros and cons and the advantages and disadvantages of
Okay.
every option. And that way, but usually I do not recommend something that would require further drilling of the
Yes.
enamel, something that would require implanting something, in the bone structure in the body.
Okay.
Okay, and I would be rather conservative on this now, just like a metal-free, removable prosthetics or the denture, if I may call it.
So,
Yes.
pustiso na yon.
Yes.
Okay. So, if they go to you, they are definitely, with you, in your practice of biological dentistry, root canal is not an option.
That's right.
Okay. Now, what is the worst scenario when it comes to root canal? Of course, I'm not talking about the dentist having made a mistake or, an infection sets in and from the very start it becomes life-threatening, which I hear it could be. A badly performed root canal. But let's say a root canal that's done by a competent doctor, so nagawa na yung root canal, ano mga dangers ngayon ng magro-root canal? Now, I try to address this to you people who are considering getting a root canal, na your dentist already told you or scheduled you for a root canal. Like, baka sabihin, sige, next week, 2 weeks from now, you're going to get a root canal. So may chance pa. Para those sa mga nagkaroon ng root canal, just listen. But to those who are planning to get a root canal, eto mga dangers. Dr. Gaba.
I would like to think of it this way. I'm thinking focal infection. When you define focal infection, this is basically a territory of bacteria originating from one source that will migrate through the blood vessels,
Right.
and create another territory of bacteria to another sensory, another organ in the body. So,
Most of the time daw, sa heart. Totoo ba yan?
well, you can see, you do not separate the tooth from the body,
okay.
Basically, every single organ of our body is interconnected to the blood vessels, okay? So, any part of the body is prone to focal infection. But in traditional Chinese medicine, there's such a thing as meridians also, okay? So, like for example, if I may say an analogy of that, It's just like a train passing from one station to the other.
Okay.
A station corresponds to one of your organ system
All
connected to other organ system of your body. A station corresponds to one of your teeth connected to other organ system of your body. So if there are bacteria, parasites, viruses, even heavy metals on one organ system or your teeth, it may settle to other organ system of your body. So I'm thinking of that now when you talk, not just focal infection, you're thinking of anything at all, may it be infection or heavy metals that may be transmitted to other parts of your body. Now, with a dead tooth, if I may call it, I call it a root cadaver. Bacteria can easily set in. I'm talking about anaerobic bacteria. These are bacteria that, thrives in the absence of oxygen, and they are more potent and they're more virulent. And this would, I'm quite hesitant, especially when patients who has, immuno-impaired problems like cancer and all, I would think twice about it. And you don't need to be a cancer patient, I always tell my patients not just to believe whatever Dr. Gaba would say. I tell them, you do your research. That's your body,
Right.
okay? So don't limit your knowledge or your options on what your doctor would tell you. What I'm doing now is just opening a window of information for you.
Right. Because the way I see it now, Dr. Gaba, mangyayari dyan, if the patient out there, went to his dentist, her dentist, sabihin ng dentista niya, kailangan mo ng root canal, is it possible pupunta siya sa ibang dentista na traditional din, conventional din, na chances are, sasabihin din sa kanya, tama si doctor number 1, you need a root canal. I guess magkakaiba lang yan sa schedule. Isa will schedule you 1 week from now, the other one will schedule you 2 weeks from now. But then, what is the option again, doctor? Pwede mo ba sabihin sa dentista mo na, doctor, I don't want a root canal, just pull my tooth. Pwede?
Yes, that's actually your option. That's actually your right.
Okay.
Yes.
So, pwede mong sabihin yun. And, okay, so, the option, ano lang to, we're being a little simplistic here. But definitely, this is another point of view that you should explore that is gaining a lot of ground and popularity because of findings na the tooth, na sinasabi ni Dr. Gaba, is an organ in itself, and what you do to one tooth will affect the whole body. And, yun na nga, from one tooth na ginawa mo ng root canal, it could affect other parts of your body negatively to the point na magkakasakit yon. So, ano ang option mo? Your option, if somebody tells you, your doctor tells you, you need a root canal, sabihin mo na lang, doctor, I would prefer that you pull my tooth. Am I right?
It's either you want it alive or not there at all.
Okay.
Yeah.
With that, we'll be back with Dr. Nelson Gaba. The topic is biological dentistry. I'm Gerry Cornejo, and we'll be back right after this. Stay tuned. Welcome back to Open House with Gerry Cornejo, where we feature people, places, and things that are in the news or who should be in the news. And as usual, whenever we talk about health, it is one of my favorite topics in this program because I believe health is wealth. We've been talking about alternative medicine, and this is the kind of things that you'll be hearing, by the way, in this program. It's always the alternative medicine, not the conventional kind, because the conventional medicine, it's easy. We've lived with it all our lives, but nowadays there are new findings in medicine and in the field of dental medicine that are not really earth-shaking or that radical, but something that actually makes a lot of sense. And one of the things that we've discussed, very common, is the root canal versus just pull out the tooth. And we have with us Dr. Nelson Gaba, practitioner of biological dentistry. Ngayon, matanong nga pala, Dr. Gaba, because you said, what was the last thing you said? If the tooth, pagsabihin, because right now, you might say, well, I've been with this dentist for all my life, for the past 20, 30 years. So, but then, you have a choice. Di ba? Pag sabihin ng dentista mo, 30 years ka na sa kanya, hey, sir, ma'am, root canal. Ngayon, sabi ni Dr. Gaba, what can you tell your dentist again? Just pull it out?
Oh yes, you have every right.
Oh.
You have every right.
Oh.
But of course, your dentist has every right also
To
you
say,
know.
look for another
Yes,
doctor?
because I wouldn't do that for you now.
Ah, talaga?
And I respect that, you know.
No, but why would the dentist say, I don't want to pull out your tooth and I want to perform a root canal?
Like, for example, if I were to be asked by my patient to do a root canal for him, I would respectfully decline and have somebody, or you know, have my best friend do it for me. You know?
No, but usually, doctor, a patient will not go to you and tell you, perform
Exactly.
a root canal on me.
Exactly.
He'll show you his mouth, he'll show you his teeth, and you're the one who's going to decide, you need a root canal.
But you know how patients are nowadays. They would dictate what you like. But then,
Marunong pa sa doktor,
but then, of course, they need to know their options. They have the right to know. They have the right for options, and they have the right to be informed.
Pero pwede ba yun, doctor? I mean, you go to your doctor, sabihin ng doctor, root canal, sabihin mo, no, just pull it out. The doctor can actually say, or is bound to say, no?
But
Posible.
I
Pero
would like to
gagawin mo
believe
yan.
that the doctor will give you options, and root canal is just an option, and extraction may even be suggested.
Ah,
So
okay.
it may be
Okay.
suggested.
Ngayon, question. This just occurred to me now.
Okay.
Kasi parang ano yan parang mga OB-GYN, no? I mean, natural versus cesarean. Mas malaki ang professional fee pag cesarean, di ba?
Okay.
Ngayon, pag when it's a root canal ba, mas malaki ang professional fee kaysa sa extraction?
Well, definitely, it's more tedious and it requires several sessions.
There
now.
you go.
Yeah. Well, I'm not implying anything
No,
though, but then of
me,
course
I'm
it's a
not-
specialty. you
Right,
know,
right.
It's a
No,
specialty,
but I'm the one implying
which I
it.
respect also now.
You know, I'm the one implying it because, I mean, unfortunately, I mean, I'm sure many of you trust your doctors 100%. But then there are those doctors, kung minsan company doctors, you know, I mean, it's like, kumbaga, may diploma, may letter, parang, di ba, I mean, it's just a factory sort of thing. Now, I'm just worried that sometimes some dentists, and I think it is very possible, maybe it happens to a very small minority, but they would suggest a root canal rather than an extraction because root canal will probably cost what, 5 times, 10 times as more? What's the ballpark figure?
Well,
I mean, 5 times at least.
Maybe it depends on of course, the experience, and of course, the location, and a
Right.
lot more things now. Yes, it may cost about 5
Okay,
times.
so
even more.
again, una-una, mas mura ang extraction. Secondly, but over and above the economics, the financing, the finances, it's what Dr. Nelson Gaba is saying, and he stakes his reputation on it, and his profession, that root canal should not be an option. Ever. Wala bang situation, Dr. Gaba, na kailangan talaga ng root canal? Wala? At all?
Well, if you really think about it, thinking that a tooth is an organ, and if you want a dead organ inside your body, do you really want it? You know?
So your answer is no.
No.
There is no scenario at all wherein you will say, eto, root canal na ito. Wala.
No.
Okay, wonderful. Wonderful. So that's clear. You know, if you just learned that one thing during this program, you know, it could save you a lot of heartache. It could save your life. You know,
It could.
in the lives of your loved ones. Okay? Lalong-lalo na mga bata pa, mga hindi ba, you know, dependent on their parents, and the parent says, okay, go to Dr. So-and-so, and he's a good dentist, he's been our family dentist. So avoid root canals at all costs. And it costs a lot, by the way. Ngayon, ito naman, back to square one. Good dental care. Are there any findings now on good dental care? Tama ba yun? Brush your teeth after every meal and floss after. What is good basic dental care, Dr. Gaba?
Okay, I would not undermine the importance of good oral hygiene.
Okay.
It's supposed to be there. It's
Okay.
part of a civilized society. We need to brush your teeth
Okay.
and floss and all of that. But I would like to make mention that I remember this is Dr. Weston Price,
Okay.
um,
Who is?
who is a very, he's a researcher, at the same time a dentist. At his time, this is, I think, pre-war, but and he would say he's fond of going to tribes, the mountains and all. One time he met a tribe. Amidst the dark skin was a very nice smile, a white smile. And curious as he is, he was checking their mouth, their teeth, and they found no tooth decay. And there was no dental clinic there, and there was no toothbrush,
Okay.
no toothpaste.
Okay.
But then he found that there's, no tooth decay at all.
Okay.
Okay, and then this did not happen just in one part of the world. He come across several tribesmen, and all that. The bottom line, what he's saying is nutrition has a lot to do with it. The food that we eat.
Okay.
Nowadays, in a civilized world, about sugar.
Yes.
Everybody knows about sugar. But then sugar can hide in a lot of things. Like in the supermarket, everything that's packed, everything that's canned contains...
Sugar lahat yan.
Yes.
And
In
sodium.
the form of
Oh,
high fructose corn
Right,
syrup. This
right.
is basically a derivative of sugar.
right. Oh,
Okay. So they say sugar doesn't have to touch the teeth to form tooth decay. Once you ingest it, once you swallow it, it goes to your bloodstream. So decay can set in, sugar can set in from the nerve going to your teeth. So sometimes you would see teeth that are very beautiful, no decay outside.
Okay.
But decay is happening inside. So
pwede pala yun.
nutrition, yes.
So yun ang nagkaka-toothache, buong-buo yung tooth, ang ganda-ganda ng tooth, pero masakit. Pag nagkaka-toothache,
Sometimes
yun
this
yun.
happens.
Okay.
Okay, it may be so through direct contact or maybe through the bloodstream. So nutrition has a lot to do with it now.
Okay.
If you're fond of bakery products, flour products, mabilis yan.
So avoid those things.
Yes,
Avoid,
carbohydrates,
Flour,
sugar.
okay.
Because carbohydrate
Okay.
turns into sugar also.
okay, so avoid
Bakery
sugar.
products.
Okay. Ngayon, brushing. Totoo ba yung ano? It makes a lot of sense to me. It's like, I guess, washing your hands, no? To as much as possible, if you can, brush your teeth 3 times a day. Or sobra ba yun? Nagagasgas din ba ngipin?
Okay, the things to consider, the hardness of the bristles of the brush,
Okay.
your age factor, of course, if you're, you medyo may edad na, the
Yeah.
wear and tear and everything
Right.
comes into play. And of course, and a lot of more things now. So brushing is important, of course, now.
Okay.
But
Flossing
then
is important.
flossing
okay.
is important because food can get stuck in between
Right.
teeth too.
Okay.
So, but then, of course, you won't get too much plaque. This is basically the food that gets stuck.
Okay.
If you're not fond of sugar and carbohydrate things,
okay.
I see people who are fond of vegetables and all that who doesn't have some problems with plaque formation.
So what's a good diet, doctor?
Well, vegetables, fruits and vegetables is nice. Something that's raw would be nice.
Meat. Pwede na rin. Wala sugar yan.
Well, meat, galito yan eh. It depends on the meat. Kasi this is another field now.
Okay.
But then, of course, because of this, a lot of pesticides, a lot of antibiotics and all that contributes also.
Okay.
So, if meat, basically, if it's free range, I'm okay. But then,
Okay.
basically, what's important is vegetables and fruits.
Okay.
Vegetables and
Well,
fruits.
not only for the teeth, the whole body, the hair, the skin, the bones, all the organs.
You're talking immune system.
Yeah.
You're talking the
Yes.
whole body.
Yes.
Remember, you do not separate the teeth from the body. So
Yes.
whatever you do to your body, you do to your teeth. Whatever you do to your teeth, you do to your body.
Okay.
So you do not separate that.
Ngayon, how about, are all toothpastes the same? Or meron talaga mga ibang toothpaste better than the others? Without naming brands.
Okay. I'm also a dentist who's not fond of fluoride.
Okay.
Okay, fluoride for me is toxic already, and I don't think fluoride is an ingredient that will fight tooth decay. If you were to ask me,
Okay.
again, basically, it's the first and foremost, the major factor is nutrition. Hygiene plays a role, but then of course there are other cleaning ingredients that can be
Okay.
incorporated to your brushing.
Right.
Others would do baking soda. Others would do,
Is
other-
baking soda good?
Yes, baking soda.
Pure
is-
baking soda, di
Yes,
ba? Yung mga iba
yeah,
talagang
yes.
diretso baking
Oh,
soda.
yes, yes.
Pero, so avoid toothpaste with fluoride.
If I may say so,
Okay,
yes.
avoid. Tapos, how about mga mouthwash? Nowadays, You know, there parang ano yan eh, parang you know, when I was growing up, we had a bar of soap for your body, for your face, for your hair. We used one bar of soap. As I got older, meron ng ano, you have soap for your body, soap for your face, and shampoo for your hair.
That's right.
Tapos nagkaroon na ngayon ng conditioner for the hair.
Yeah.
So, yung ba mga mouthwash, ganun din? Because nowadays, parang the message is, kulang yung brushing na yan, kailangan mong mouthwash. Is that true?
Well, let me give you the ingredients that I don't like in mouthwash.
Okay.
Saccharin, alcohol, you know,
Okay.
things like that. And then, what would be, okay, do your mouthwash, but then these are chemicals. What would be
Okay.
nice is oil pulling. I don't know if you've heard of
Oil pulling, yes. Describe oil pulling later. Medyo mawawala na tayo ng panahon ngayon, but we have one more segment. I've heard of oil pulling. Oil pulling, ha?
Yes.
OIL pulling, as in hinihila.
Yes,
No?
yes.
And this is something that I've heard also that is not only for dental health, but it's really for overall health, di ba? Oil pulling, this is going to be our next topic later. So what you're saying is instead of, pero do you recommend, or are you saying, if you're going to get a mouthwash, siguraduhin niya walang alcohol, walang saccharin, ganun ba?
Yeah.
Pero are there such meron bang mouthwash na walang saccharin? I've seen no alcohol. Naka-advertise pa. No
you always
alcohol.
read the labels.
Oh,
no fluoride, no alcohol,
Okay.
no saccharin, and all that. You have
Okay.
other ingredients, you know. But read the labels. Read the
Okay.
labels, and buy. You don't see those things in ordinary groceries. You get them in health stores now.
So you avoid saccharin, fluoride, and
Alcohol.
those three.
Yeah.
Why alcohol?
Well, basically, it's it dehydrates. It's because
okay.
of hydration now.
Okay.
And
Because I'm talking about masama ba yung if you drink scotch or brandy or wine and there's alcohol.
well, I'm thinking.
That's what I got a little worried about.
Yeah. Well, I'm thinking red wine would be nicer, you know, if you're thinking of that, because you always think of the basic components that can help
okay.
you. Yeah,
Basta avoid soaking your teeth in saccharin and fluoride.
that's right.
And of course, alcohol din. Pero, so, we're going to go on a break. When we come back, we're going to be talking about what to do after you've taken some scotch, brandy, wine, or beer with Dr. Nelson Gaba. We're talking about biological dentistry in Open House with Gerry Cornejo. And we'll be back right after this. Stay tuned. Welcome back to Open House with Gerry Cornejo, where we feature people, places, and things that are in the news or who should be in the news. And if you've just tuned in, we're talking about biological dentistry, something that is very opposed to what we know as the conventional, traditional dentistry. And we won't go back into this topic, but according to our practitioner of biological dentistry, Dr. Nelson Gaba, root canal is not an option when it comes to dental care, dental health. Root canal is not an option. So, buti na lang, tanggalin na lang yung ipin kesa get into root canal. If that's only one thing that you learn in this program, I'll be very happy with that, and so will Dr. Gaba. And then second thing we were talking about earlier is dental health, and sabi ni Dr. Gaba, okay, there's nothing wrong with brushing your teeth after every meal and flossing, but it's not only the things that stick in your teeth that destroy it, but things that you take internally, and that would be sugar and flour, bakery products, di ba? Refined sugar, refined flour. And also, pagdating naman sa mouthwash, look at the label. Is there anything really basically wrong with mouthwash? Wala naman, unless may ingredients na yon.
Oh yes, it's the ingredients basically.
Okay.
You can actually live without a mouthwash if you wish. No?
Okay, so, well, I figured that out long ago.
Yeah.
No, na parang after brushing your teeth, it's not enough. Di ba ganun ang message ngayon? Commercial message.
Yeah.
It's not enough that you brush your teeth. Kailangan mo ng mouthwash. Well, you know, they just want to sell the product to you. But if you want to use mouthwash, tingnan mo yung label, avoid mouthwash na may saccharin, na may fluoride at alcohol. Okay, very important. Something new, something not too many people have heard about. It's called oil pulling.
Yeah.
Dr. Nelson Gaba, what is oil pulling and what does it do?
As the name implies, you utilize oil as a
Okay.
mouthwash,
Okay,
and you sort of swish it, gargle with it.
okay,
For others would do it for 5, 10, 15 minutes.
okay. Tagal na
What
na?
it does, yes,
Ah.
what it does is basically it detoxifies. No, under our tongue, basically, or there are blood vessels that that can accept or eliminate fluids.
Ito mo na, doctor, excuse me When you say oil, we're talking about what kind of oil? Are we talking about I heard virgin coconut oil.
We are in a tropical country. Coconut oil is in abundance. and
Okay.
Very rich. Coconut oil is the best oil that we can use now.
We are also airing in 7 Asian countries
Yes.
that might not have coconut.
Yes.
Wala silang coconut. What kind of oil will they use?
Wow, I would still say coconut oil,
Coconut
if
oil.
I may say.
Maghanap kayo ng coconut oil. Look for coconut oil. So use virgin coconut oil and then
Gargle with it,
yeah.
swish with it, and what it does is it detoxifies. no?
Okay, how much? First of all, let's be very. You do it. I heard you do it first thing in the morning when you wake up. Ganun ba? Or you can do it anytime.
Well, okay. What I do is first thing in the morning is I would just recommend that glasses of water that you
Okay.
take.
Okay.
And after which, that's the time you do your
Oil pulling.
Your oil pulling. Yes.
Ngayon, how much oil should you put? One tablespoon.
Yes, 1 tablespoon. will
Okay,
do.
so-
It doesn't have to be that plenty.
Okay, of virgin coconut oil,
Yes,
and
yeah.
then you swish it around your mouth for how long again?
I want to encourage it. Kaya it doesn't have to be that long,
Okay.
like 15 minutes.
Oo.
It might be a bit too long.
Anong minimum?
Just 5 would be too. While you're
Yes.
doing things, and all that, and after, when you swish it out, you spit it out, you just don't spit it out because it contains a lot of toxins now. Maybe what you can do is you can get a tissue and you spit it out in the tissue and throw it in the garbage, not through your sewage system.
Not in your sink.
Yes, it might create some. It's very toxic. I'm telling you.
Ganon
Yes, especially once you do it.
Oh.
Oftentimes others, would. So I would rather be careful about how you
Okay, and this is
Supposed to
done every day.
every day.
Every day. So oil pulling, in the morning, best practice would be to drink 3 to 4 glasses of water.
That's right.
Okay, so after you hydrate 3 to 4 glasses of water, and I was told that this is also a signal for your digestive system to wake up. Hey, wake up, the body's awake. And then get into oil pulling. So, mga 1 tablespoon of virgin coconut oil, place it in your mouth, swish it around, around the gums, around the whole mouth, in other words, for at least 5 minutes, but ideally 10 to 15. And then after that, according to Dr. Gaba, that oil residue that's now in your mouth is so toxic that you should really dispose of it properly. And the best way he suggests is a tissue,
Yeah.
and then maybe flush it down the toilet. Hindi rin.
Yeah. To garbage. The garbage.
Sa garbage. Okay. Ngayon, why virgin coconut oil? Why not water? Why not mouthwash?
Well, oil has its essential properties of detoxifying. It's very natural to the body and all that. So oil is good. If I may also suggest, we can talk about metals in dentistry because there
Okay.
are a lot of, toxicity in metals. In dentistry, metals contains nickel, chromium, cobalt, aluminum, and all that. And this is basically, it's not good to your immune system also. So you would rather not go on metal restorations.
So what you're saying is no to braces, metal braces.
Well, braces is essential for alignment.
Okay.
But if there are options of what to use, or material to use, that would be better.
What are the options?
Basically, it's almost always nickel.
Okay.
The brackets, there are basically glass. Glass is a better option. If I
Okay,
may say.
ceramics yata, meron? O wala?
Ceramics contains a bit of aluminum, but
okay.
it's better than nickel.
Okay, so what would you recommend? I mean, if the doctor says because of the condition of your teeth, you will need braces. Ano mga options natin ngayon? Tell your doctor, use nickel, or SOP na ngayon, nickel na talaga?
I always tell my patient there's no one formula for every person.
Okay.
That's why in biological dentistry you need to do compatibility testing of every material before you remove all those toxic metals inside your body. You need to make sure that what you place in a patient's mouth is not also toxic and compatible to his chemistry, his body chemistry. That's why we do compatibility testing.
Okay. So it varies from patient to patient.
Yes, as much as possible. If you don't need braces, don't do it. And if in case you really need it, if you can get away from metals, that will be a lot better.
Okay. Ngayon, Doctor, how do they get in touch with you? Two things I'd like to talk about.
Yeah.
Sometime in May, you're going to be giving a talk sa SMX.
Well, actually, I'm just chairing a forum, a biological dentistry forum, wherein we invited 2 foreign speakers from the International Academy of Oral Biological Dentistry and Medicine.
When is this, Doctor?
This is May 13,
Okay.
2015, at the SMX Convention Center
Okay.
in MOA. It will be a whole day forum, which starts from 7:30 in the morning to 5 p.m.
Are these for doctors or is this for
It's
laymen?
actually for dentists, doctors, alternative health practitioners, everybody, health enthusiasts.
What is the name of the convention, of the
It's
event?
entitled Trends in Biological Dentistry.
Trends in Biology. Is this the first time such an event will be discussed?
What in this size, yes, and of course, it's basically with, of course, the under the 106 Philippine Dental Association Convention. So it will be under that particular activity.
Okay. It's going to be under the 106th
PDA annual
okay.
convention.
And one of the topics will be trends in biological dentistry.
Yes, yes.
So this is not. This is going to go on for several days. Pero itong trends in biological
for a day.
dentistry, May 13 lang.
Yes,
Sa
May 13.
SMX MOA.
Yes.
Okay. So if you're interested to learn more about biological dentistry, then it's going to be at May 13 as a SMX, sa Mall of Asia. And this will be a whole day affair. I guess 9 to 5, what's the time?
7:30 in the morning
Okay.
till 5 in the afternoon.
And you will be one of the speakers?
No, I'll just be moderating there.
Okay, and our guest now, si Dr. Nelson Gaba, will be one of the moderators. And who will be the main speakers
It's
again?
Dr. Don Ewing
Okay.
and Dr. Michael Margolis.
Okay, they are from
They
which
are-
country?
From the U.S., Dr.
Okay.
Ewing is from basically from Margolis is from Arizona, and Ewing, yes,
So from mga Amerikano ito,
mga
from the
Amerikano
USA.
sila yan.
Okay, so if you're interested to know more, May 13, SMX Convention Center, MOA. Now, if anyone wants to get in touch with you, how do they get in touch with you?
Well, my contact number at the office is 807-2696.
Okay. And do you have a mobile phone that they can text?
So yes, it's 0917
Yes.
301 5859.
0917.
301
Yes.
5859.
Okay.
And my email address,
Yes.
it's docg, that's DOCG _ biodent,
Okay.
biodent
Okay.
at yahoo.com.
Okay.
They can visit my website also at www.yourholisticdentist.
Your holistic dentist.
Yes, without a W. It's HOLISTIC.
Yes, but it's YOUR.
YOUR.
Your holistic dentist.
.com.
Okay. I got that. And I'll repeat it, don't worry. Okay. Your holistic dentist. At, .com.
.com.
Yourholisticdentist.com. Okay.
That's right.
If you want to get in touch with Dr. Nelson Gaba, landline 807-2696. Mobile number 0917-301-585. If you want to send...
5859, I'm sorry.
Excuse me?
5859.
Oh, sorry, I missed the number. Again, mobile number 0917-301-5859. Email docg, that's DOCG _ biodent, BIODENT @yahoo.com. Again, docg _ biodent @yahoo.com. Website, yourholisticdentist.com. YOURWHOLISTIC.
I'm sorry, there's no W.
Oh, okay. Again, your holistic, YOURHOLISTIC, dentist. Okay? Yourholisticdentist.com.
That's right.
Pero pinaka-importante, 807-2696.
That's right.
At 0917-301-5859. And I'm sure if they Google your name, they'll come up with several things. And to Google his name, again, it's Nelson Gaba. NELSONGABA. So with that, we have less than a minute to go. Dr. Nelson Gaba, thank you very much for the enlightening talk you gave. No?
Yes.
Sabi ko nga sa kanila, if they just learn about don't ever get a root canal, I mean, that could probably save your lives and those of your loved ones. Sir, your audience, any message you have for them, please?
Okay. I would just like to say that you do not always separate, good oral health to systemic health. It's always correlated. And you have the right to know, you have the right to be informed, and you know your options. You need to know your options. Whenever you go to your doctor, ask for whatever is there, what they're giving you, what they're placing in your body. And of course, always read the labels in whatever you do. So your teeth, you do not separate it from the significant whole. You have a healthy smile, you have a healthy body. Thank you, Doc.
Okay, thank you
Mr.
very much.
Cornejo.
So with that, thank you very much to Dr. Nelson Gaba. And probably it's before May or sometime around May if we might be able to invite the main speakers of
nice.
biological dentistry.
Yeah.
So until then, I'm Gerry Cornejo. Take care. I love you. God bless you.